So in this session, we're going to talk all about the MSRA exam. And by the end of this session, there are a couple of things that I want to have covered. Number one, what is the MSRA? Just so you understand a bit about what the assessment is all about and how you can therefore focus your preparation. We're going to look at some common mistakes that I see people do when it comes to MSRA preparation and trends that I see that A, get people higher scores and B, that tend to get people slightly lower scores. We're going to look at some sample questions, both from a clinical point of view and from a SJT point of view. I'll talk about all of these in a second and how to answer them, how to prepare, talking about the dual preparation approach, the knowledge versus the practice side of things, how technique plays a huge part in this exam and how your preparation should be focused on both technique as well as the knowledge, and then finally how we can help you prepare for this exam as well. So quite a lot that I want to cover by the end, but hopefully by the end, you'll feel in a much better position to go into your preparation for MSRA. A quick introduction if you don't know who I am. I'm Dr. Amin Arora. I'm a portfolio GP now in full-time medical education. Hopefully we've helped you at some stage in your career before. I'm lucky to be a fellow of the Royal College of GPs, and I've had quite a few different roles all within medical education in different aspects. So previous GMC PLAB 2 examiner, I've been involved in GP training as a program director, I've been involved in specialty recruitment, so looking at the MSRA exam, writing questions, for example. So lots of experience that can hopefully help you in your MSRA preparation. And for those of you who don't know, we now run Aurora Medical Education. Apart from MSRA resources, which we'll talk about in a little while, we've hopefully, like we said, helped you in different stages, or will be helping you in different stages of your career going forward. So what is the MSRA, the Multi-Specialty Recruitment Assessment? As the name suggests, it's an assessment that's used by lots of different training application programs, and how each individual specialty deals with MSRA is slightly different, but the exam, the assessment, is the same assessment across the board. It's a free assessment. It's a computer-based assessment that you can take at various centers. It's not that you need to travel to one particular place to take the exam, and it's designed to assess various competencies that are outlined in the person specification document. So depending on whichever specialty you're looking to apply for, there are person specification documents, and the MSRA assesses various competencies that are in this document. Now, the MSRA is split into two different papers, a professional dilemma paper and a clinical problem solving paper. We're breaking these down in a bit more detail shortly. So two papers together. Usually it's the professional dilemma paper first, then you get a 5-minute break, and then you do the clinical problem solving paper. Now, the professional dilemma paper is based around 50 SJT questions, or situational judgment test questions. I'll go into a bit more detail about what these are about in a short while. And a clinical problem solving paper has 97 MCQ based questions. Again, I'll talk about the different types of questions in a second. 95 minutes for the SJT paper and 75 minutes for the MCQ paper. So in total, the whole thing takes around 3 hours, around 175 minutes, with that break in between. Now, there's no pass mark as such for MSRA. You get a score based on bands. So you get band 1 to band 4 for both papers. So for example, you might get band 3 in your professional dilemma paper and band 4 in your clinical problem solving. Band 1 is the lower side of the scores, band 4 is the higher side of the scores. And remember, it's a ranking based system. So the higher the score you get, the more likely you are to get into training or to put yourself in a better position to get into specialty training. So no pass mark, no maximum score. You're given bands when you get your results of the assessment. And like we mentioned, the score itself can be used in different ways for different specialties. Some specialties say it's all based on your MSRA. So whether you get into a specialty training program or not is purely dependent on the score that you get in MSRA, whereas other specialties use MSRA score as part of an overall assessment, for example, with interviews or other assessments. So again, worth looking at the specialty websites to see how they use MSRA. But remember, once again, regardless of which specialty you're applying to, the MSRA exam is exactly the same. So the resources that you use are not different. For example, if you're praying for GP or radiology or surgery, for example, it's all the same assessment. Let's talk about some common mistakes that I tend to see, and we'll break these down in more detail as we go through the rest of this video. So The first mistake that I see is people often just go with a question-based approach. So they'll sign up to a question bank and do thousands and thousands and thousands of questions. Of course, you learn quite a lot by doing that, but if you purely go with a questions-based approach, then you're going to have a lot of gaps in your preparation. We'll talk about this in more detail. The second mistake or trend that I see in people who don't score as well as they can is a lack of planning or a lack of strategy. And we'll talk about strategy and how to plan your preparation a little bit later on in the video. But if you don't have any plan or any strategy at all and kind of go at it haphazardly, then you're probably going to end up with a lower score than you're capable of. Thirdly, some people don't really focus on the technique side of MSRA, and whether you're doing your clinical paper or your professional dilemma paper, technique plays a huge part, and we'll talk about this in much more detail shortly. Sometimes people don't use time pressure, so they do lots and lots of questions, but it's all in a relaxed manner. They do a couple of questions here or there. There's never really that time pressure, and as you'll see when we talk about the time that you get to answer questions later, it can be quite a tight time frame. So at some point, things like mocks, for example, are important, and some people don't do those. And finally, inadequate focus on one paper type. So some people, for example, say, look, I'm okay with clinical, I'm going to do a lot of work on the professional dilemma paper. Some people say, well, the professional dilemma paper, I can just kind of guess it, I don't really know how to do it, so I'm not going to focus on that. I'll focus on the clinical paper, and therefore you end up with a disparity in terms of your banding. So it's really important to focus on both types, and again, we'll talk about how to do that in a short while. So common mistakes that you don't want to be making, but it's about understanding them first so you don't make them in your own preparation. So let's talk about the two papers in a bit more detail. And let's start with the clinical paper. Remember, clinical paper is 97 questions in 75 minutes. So on average, you're getting 46 seconds per question. That's not very long, but of course some questions you'll take much quicker than this, and some you'll get a bit of time to do a bit of extra thinking. But on average, 46 seconds per question, and it assesses your ability to apply knowledge to make clinical decisions. So it's not just a pure knowledge test. It kind of assumes that by now you have a decent amount of knowledge, but it's how do you apply that knowledge in problem solving and making clinical decisions on the spot in a short or a rapid time frame. And that's quite difficult sometimes to assess from an MCQ point of view, but that's the aim of the assessment. So it's not just how much do you know, it's how do you apply it. And the application of knowledge is where the technique side of things can really help. And we'll give some examples of that in a short while. So there are 5 key competencies that are assessed in the clinical paper. Investigations, and which investigations would you choose next, for example, which are the first line investigations, which are the investigations that can help you answer the question that you're trying to assess in that situation. Diagnosis, so of course, what is the most likely diagnosis, perhaps in a scenario that you're given. Emergency and emergency management, so knowing how to take quick decisions in emergency situations and making sure you understand those. Prescribing, so this can involve not just what is the right drug to give, for example, but things like understanding of interactions, side effects, and how they influence decisions in a particular scenario. And then ultimately management as a whole. So management both from a clinical point of view, but also management from a non-clinical point of view, or an advice point of view, or a lifestyle change point of view, for example. And all these things can be assessed across the clinical paper. And at some point, all of these will be assessed in detail. Now, there are 12 clinical topics to bear in mind if you look at the details of what the exam contains. I say 12, but actually some of these contain 2, 3, or 4. So actually, it's quite a lot of things that you need to be covering. And this is why we say if you just take a questions-only approach, you're probably going to have some gaps in knowledge. So cardiovascular, dermatology, ENT, eyes, endocrine, metabolic, gastroenterology, nutrition, infectious disease, hematology, allergy, genetics, musculoskeletal, pediatrics, pharmacology and therapeutics. People often don't pay attention to this one. Psychiatry, neurology, renal, urology, reproductive, and respiratory. So as you can see, pretty much any system can come up. A question about pretty much any presentation can come up. You do need to cover quite a lot in terms of getting a good score in your clinical paper. Now, the clinical paper consists of 2 different types of questions: your SBA questions, or single best answer, and your EMQ questions, or extended matching questions. So let's break those down. So an SBA is where you have to choose the single best one option out of 5 possible options, and those options relate to just one particular question. So you'll get a STEM and you'll get 5 options, and you choose the most appropriate. Notice it says choose the best option from 5. This means that you may have 2 or 3 answers that are potentially right, but you've got to choose the most right, or the best option from 5. So that's your SBAs. Then your EMQs are slightly different. You have lots of different options instead of just 5. You've still got to choose the best one option from maybe 10 or 12, but those 10 or 12 answers may relate to 3 questions or 4 questions in a row. So you get 3 or 4 questions batched together. The answer list relates to all 3 of those questions. So EMQs are very different to SBAs. Some people find SBAs easier. Some people find EMQs easier. It's important to practice both when you think about preparing for MSRA. So let's do an example then. We're not going to give the full 46 seconds, but it might be worth pausing at this point, having a think about the answer, and then we'll talk about the knowledge and how that's important, but also how technique can help in questions as well. So pause the video at this point and then restart when you think you've got your answer. So the answer here is E, bronchiolitis. Well done if you got E. I'm sure many of you got E, but I'm sure there's quite a few of you who didn't get E. So let's break this down now and see how both knowledge and technique both need to be applied to get a correct answer in a clinical question. Let's break this down then. So the first thing is you read the stem, of course, you see a new patient in the department, and when examining him, you notice some hand findings. So the first thing is you have to understand what the hand findings are. So hopefully most of you looked at this picture and straight away thought this is clubbing. This is something that you deal with very often, I'm sure. That's the first part of the question. Then you're asked to look for the least likely cause. Now, there are probably some of you watching this right now who missed out the word least or didn't recognize it was the least likely cause, because what your brain does is miss out small words. It's very good at kind of skimming things, and you don't focus on the small words, but you focus on the big words. Now, the word least here is probably the most important word in this whole question. And if your brain is not picking that up and just reading it as, okay, this is clubbing, looking at the answers, that causes clubbing, I'm sure it is, tick, move on, then your knowledge is fine, but your technique has let you down. So one thing that's really important to remember in questions like this is to make sure you don't miss the small words, least, not, most. Those kind of things change the question completely, and you don't want to be missing those because you get the answer wrong from a technique reason rather than a knowledge reason. The second thing from a technique point of view here is to change a double word to a single word. Now, it doesn't make too much difference in questions like this where you've only got small answers or small stems for each answer, but sometimes you get 1 or 2 sentences in A, and then another 2 sentences in B, then another 1 sentence in C. So quite long answers. And if you're trying to find out the least likely answer, you're thinking, is this least likely? Is this least likely? Is this least likely? It starts to put pressure on your brain. Least likely, double words are hard for your brain to keep up to date with as you go down lots of other complex things that you have to be thinking about. So try and change any double word that you see to a single word. In essence, change least likely to false. It's much easier for your brain to think, is this false? Is this false? Is this false? So double words can often get you. For example, which is least likely? False. Which is most appropriate? True. Which is least appropriate? False. Again, try and change every double word to a single word to put less pressure on your brain. And the third thing that's really important to pick up here from a technique point of view is when you're skimming answers, sometimes your brain reads what it wants to read. Now, a lot of you guys might not have put E because you may have read that at speed as bronchiectasis, because your brain thinks clubbing, you think of all those lists of things that you learned from the past about what causes clubbing, you know bronchiectasis is there, and you may well read that as bronchiectasis. Of course, this is bronchiolitis, 2 very different conditions. Bronchiolitis does not cause clubbing, and this is why E is the answer to this question. So when it comes to a question from a clinical paper point of view, yes, you need to know the knowledge side of things. You need to know the different causes of clubbing. This is one of our blue clinical flashcards. You've got your respiratory causes, your GI causes, your cardiac causes, your miscellaneous causes. Lots of you will know this, of course. So number 1, you've got to work out that this is clubbing. So you've got to apply your knowledge to that image. But secondly, you've got to use technique. Number 1, don't miss the small words like least. Make sure you change double words to a single word, and then try not to read things as your brain wants to read them. Make sure you go through them in detail. And when you break this down, you know that A, B, C, and D all do cause clubbing, but of course bronchiolitis doesn't, and therefore that is the answer to this question. Now, a clubbing question seems like a very easy question, but you can see there are 2 or 3 things here that might lead you to get this question wrong, and it's very important, therefore, that technique plays an important part in terms of your preparation. Let's try another example. Again, think about this question, pause if you need to, come up with the answer in your mind, and then restart, and we'll break it down again. Okay, great. Now, the answer to this question is C. Hopefully you thought C. I'm sure there's a lot of you who are doing this right now who didn't think C. So let's break it down from a knowledge and a technique point of view. You're reviewing a patient who's been admitted with a suspected subarachnoid hemorrhage. Which of the following statements is incorrect in terms of this condition? Now, the first thing, again, some people may have misread that as correct or not, or your brain might have just missed the fact that you're looking for the incorrect statement. So if that was you, that's fine. That's why you're doing these questions. So you don't do these things when you're practicing and then in the exam going on later. So make sure the small words are sometimes things that we miss at speed. So you're looking for the incorrect. You can change that to false if you like, which is the false statement. Sometimes it's easier to find false or true rather than incorrect, unlikely, etc. A, B, D, and E are all true. We'll go through these in a second. C is the only false statement. Now, there are a couple of important things apart from missing the small words that are important in this question to note. Number one, the difference between soft words and hard words. When it comes to clinical questions, try and have some kind of subconscious understanding of when you're reading a soft word and a hard word. What do I mean by soft words and hard words? Now, if you look at option A, nimodipine could be useful as part of hospital management. That word could there is an important soft word. Now, you may look at this very quickly and miss that word could. Nimodipine, hospital management, subarachnoid, nimodipine, I read that and you think that's a true statement. It is a true statement. But if you didn't know that, the word could is very important. It's a soft word. If you see soft words like could or may, they very often put the likelihood of a statement being true as much higher, because even if it's 1 in a million, that statement is true. So look out for soft words. Another example of a soft word here is may. Bleeding from the circle of Willis may have led to this occurring. Even if you didn't know that the circle of Willis can cause subarachnoid hemorrhages, then that word may, from a technique point of view, has to be high on your list if you're trying to make a more educated assessment or an educated guess. So those are two soft words, which puts A and B much more likely to be true. Now, the opposite of soft words, of course, are hard words, and you've got two hard words here in D and E. You've got all and you've got always. Now, when you see an all or an always or never or something that's 100%, you've got to pay attention to that, because very unlikely anything is 100% in medicine, right? Even if it's 1 in a million, that word is going to be false. That statement is going to be false. Now, that's the first thing. You've got your hard words, so you see the difference between soft and hard. But secondly, here you've got negatives before them. So angiography isn't needed in all cases. That's a true statement, because you can't say that anything is done in all cases. So that's true, because it's telling you that it isn't needed. And also there's a negative here as well. The headache is not always occipital in nature. Again, you might think headache, subarachnoid, occipital, and straight away your brain wants to make that fit, but it's a negative here, not always. Again, the smaller words are often missed. You may miss the word isn't, you may miss the word not. So you may pick up the hard words and think that, very little is 100% in medicine, so that's unlikely to be true, which is a correct thing to think. But when you add the negatives in it, the small words that your brain can so easily miss, you can see how that question could be got wrong. So if you now know that A, B, D, and E are all true, then you know that C has to be false. Now, you may know that mortality rate is actually very low. The mortality rate, in fact, is around 50% when it comes to subarachnoid hemorrhage. So you may know that from a knowledge point of view. But if you didn't know that from a knowledge point of view and you weren't quite sure what the percentage is, and let's be fair, you can't remember percentages like this for all conditions. You can use process of elimination, but to work out a process of elimination, you have to know that A, B, D, and E are all correct, either from a knowledge point of view or use the little bits of technique in the answer as well to make a more of an educated guess, rather than just saying, I don't know here, let's just put any option because I'm just not sure. And that is a wasted question. And that's an example of how technique can play a difference, even if the knowledge isn't quite there. So yes, you might know a lot about subarachnoid hemorrhage, but again, if you haven't picked up small words, for example, in the questions or the answers, you may still get that question wrong. And that's why attention to those is really, really important. So from this question, technique points, pick up the word incorrect, because that can change the whole way that you look at that question. Notice soft versus hard words. Remember, a soft word makes a statement much more likely to be true. A hard word makes it likely to be false because of the 100% nature. And then you can use a process of elimination, but you can only use process of elimination when you haven't got the knowledge there, if you work out all the technique parts of a question. Of course, there are key clinical points that you need to know for subarachnoid hemorrhage. And you can see how even though you might know all of these statements and you might learn them all from a knowledge point of view, you can see if you don't pick up some of the negatives or the soft or the hard words, you may still get a question like this wrong. So really important to focus on both knowledge in your preparation and technique. So a couple of things we've picked up already from a technique point of view, things that you should be focusing on when you do your questions. Number one, if you see a double word in a question, try and change it to a single word. Least correct, change that to false. Most appropriate, change it to true. Give your brain less to think about as you go down the answers. Number two, small words are sometimes more powerful than the big word. Do, don't, are, aren't, not, usually, common, least. These things change the whole question. Often your brain will skip over them because your brain focuses on the bigger words. Number three, soft versus hard words. Again, we've just given a quick example of this. Look out for soft words. Can, may, sometimes. These put a much more higher likelihood of that statement being true. Always, never, these are 100% hard words. Make sure your brain is starting to almost subconsciously pick these up because it can help from a technique point of view. And then make sure every single word fits. Sometimes you're reading through a statement and 90% of that statement is true, and your brain just believes that the rest of that statement will be true, whereas actually the last word in that statement may turn it into a false statement. And sometimes because you're thinking it's true from the beginning, that last word doesn't change what your brain thinks. Very important to make sure that every single word of a statement is either true or false before you put your mark to it. So some quick overview of some of the technique things that are very important when it comes to MSRA clinical. And when you do your mocks, for example, and certainly in the mocks that we do, we focus a lot on things like this so that it becomes second nature as you go through more and more questions. Let's focus on the professional dilemma paper then. This is often the paper that people often struggle with, and the marks they get can be slightly lower than what you're expecting. So just a quick recap, there are 50 SJT or situational judgment test questions in 95 minutes. You get a little bit longer per question for these, 114 seconds on average, but some are going to take you longer, some are going to be done a little bit quicker. What does this assess? How someone behaves when posed with a professional dilemma at work, and it tests your ability to judge a situation and act appropriately. So this paper contains no clinical knowledge assessment at all. There's nothing to do with clinical knowledge. It's all about situations that you're presented with from a work point of view or a professional point of view, and thinking about how you can judge that situation and what's the most appropriate action to take based on things like GMC, good medical practice, medical ethics, etc. 3 key competencies tested in this paper: professional integrity, coping with pressure, and empathy and sensitivity. So all questions will have something related to at least one of these competencies. Now, there are 2 types of questions when it comes to the professional dilemma paper. You've got ranking questions and you've got multiple choice questions. And how you approach these from a mindset point of view is very important when it comes to technique. And we'll talk about these in a short while. Let's start with ranking questions first. So in ranking questions, you're given a situation or a scenario, a situation that you're exposed to, and you're given 4 or 5 actions that you can take. And your job is to rank those options from the most appropriate action that you should take down to the least appropriate action that you should take. So 1, 2, 3, 4, 5, or 1, 2, 3, 4, depending on how many options you're given. That's ranking. Then you have your multiple choice questions where you're given 8 actions, not 4 or 5, 8 different actions, again, related to a particular scenario that's being described or that they kind of put you into. And you have to choose 3 of them, which in combination make up the most appropriate action. So ranking is where you have to rank the options in order from 1 to 5. Multiple choice is where you have to come up with a combination of 3 things together as a collective that make the most appropriate overall action to take. Now, there are differences in how you approach these. Let's do some questions to show you how technique can really help. So let's start with a ranking SJT question example. Again, I'd urge you to pause the video, think about your answers, and then restart, and we'll talk about what the right answer is, but more importantly, how you can use technique to get to a better understanding of how you put these ranks. Now, this is a ranking one, so remember, you've got to put all 5 answers, but you've got to rank them in order from most appropriate to least appropriate. Okay, so pause, have a think, and then restart. Okay, let's go through it then. I'll give you the answer in a second, but I'm not too worried about exactly whether you got the right order or not, because there can be some differences. And remember, when you get your MSRA exam, you don't need to get everything exactly the right order to get the mark. It's kind of a graded marking system where, depending on how many you've got in the right order, you score higher on that question. But don't worry about that too much. Let's focus on your technique in terms of preparation. You're an FY2 doctor in accident and emergency, and you're seeing a male patient with a suspected pulmonary embolus. He's becoming verbally aggressive throughout the consultation. He's angry about how long he's had to wait. You feel threatened, that's important, as he is pacing the cubicle and has punched the wall. Now you're supposed to rank these in order, depending on the most appropriate action down to the least appropriate action. Now, before we give you the answer and talk about how to approach this, let's look at how technique can help, or some things that you can think about in frameworks to try and help you with these types of questions. The first thing to think about in SJT is the and versus the or approach. Now, we just did a ranking question. Now, ranking questions, you should be thinking in the or approach. So if you go back to the idea here, you're thinking, would I do this or this or this or this or this? So I've got 5 options. Which one is most appropriate? Say, for example, you choose A. Okay, so you put A as your top rank. Now you're down to 4 options. Again, you've got to rethink, would I do this or this or this or this? So you take away the fact that you found the most appropriate one. That's done now. You've got to think of the remaining 4, would I do this or this or this or this? So you may think that B is the next most appropriate thing. So you take that out and put it as your answer. Now you're down to 3 options. They may all be pretty poor options. You may think that I wouldn't do any of these, but you've still got to think, out of these 3, would I do this or this or this? Knock one out, you're down to 2. These may be very bad options, things that you would never think about doing actually. You've already, you choose A, B, or C generally, but now you have to choose out of these 2, would I do this or this? And you've got to find one reason at least why you're putting one above the other. And we'll talk about what those reasons could be in a second, but it's the or principle that you should be thinking in ranking questions. We'll talk about the and principle in a second. There are 4 C's that you can think about when you're approaching an SJT question: clinical, convenience, communication, and colleague support. Now, these won't relate to every question that you do, but they're just 4 C's that you can think about to try and help you work out, is this better than this? Or would I do this or this? Clinical, of course, generally bases around patient safety. Is there anything in this question that tells me there are patient safety issues? Generally, those are going to be things that you're thinking about doing higher, of course, and most people would get those without thinking too much in these questions. C number 2 is convenience. Convenience for you and convenience for others. So for example, convenience for you. Is there things that there's been described as actions that make it inconvenient for you? For example, mean that you have a meeting to get to, you have teaching to get to, you'd miss it if you do it. What's the convenience factor? They're asking you to maybe stay behind against over your normal working hours. Is that convenient to you? Think about convenience for you as a trainee and how that impacts what you would do. Secondly, convenience for others. For example, is it fair to let other people wait? Colleagues, for example, or patients, for example. Where's the convenience factor there? If you do say have to prioritize something and not see a patient straight away or not talk to a colleague straight away, if it's not convenient, how do you communicate that across to you? So convenience is an important thing to bear in mind, both for yourself in a situation and also for others involved, whether that be patients or whether that be other members of staff. C number 3, communication. Again, communication with patients, communication with colleagues. If, for example, you're thinking about asking a patient to wait because you have something more clinical that needs to be dealt with first, how are you communicating to that patient? Are you letting them know, apologizing for the delay, advising them of the fact that you're going to be a little bit later? Is there any way that you need to think about communicating to them? Also, communicating to patients for clinical situations. So, for example, if somebody needs a translator, for example, because the communication is not quite there from a language barrier point of view, or you're worried about communication, for example, from a consent point of view. What are the kind of things that you think about from a communication point of view that would help determine what actions you take? And then you've got communication with colleagues. So, for example, do you need to chat with a colleague? Are they struggling? Is there a need for communication there? If you are asking a colleague to wait, or if you're asking a colleague for help, how do you communicate that appropriately? Again, what actions are there talking or related to communication, and how can that help you differentiate one answer versus another? And the fourth C is colleague support that's available to you and colleague support that may be needed by a colleague. So for example, if you're in a situation where you've got multiple jobs and you're wondering how to prioritize them, or you think I need to do this one first, but there are two other things that I need to be doing, what colleague support is available either to help you in that situation, or what colleague support is available to help you because you feel out of depth. For example, there's somebody unwell or there's a situation that's unfolding and you think you need some more senior colleague support. Who is available to you and how do you utilize that help? And secondly, is there any need for colleague support? So for example, if the scenario is talking about someone who's struggling or someone's in a difficult situation or they just need some help, how can you help support that colleague? Are there any actions that you should be taking to support that colleague? So 4 C's are worth bearing in mind because in some scenarios you may struggle. You may find the top one is really obvious, the bottom one is really obvious, but in the middle, it's not quite obvious as to which one you should put above the other, and sometimes these 4 C's can really help. And the third thing to bear in mind from a technique point of view is what seems right versus what seems right now. And you might read a lot of statements and think, actually, that seems like a reasonable thing to do. I think that's a fair enough action for me to take. But is it going to influence the situation now? So it's really important to think in that context. Yes, these 4 things all seem reasonable, but which is the one that's most appropriate to change the problem now or to impact the problem now? And when you start looking at it in that framework of what seems right, yes, but what seems right now, then you can sometimes help you put one thing above another. So when you look at ranking questions, the first thing is think of the or approach, and then you've got your 4 C's, and then the now thinking is really important. So when you do this question, let's go back to the ranking question then. The example that we're going to talk about has a suggested order of E, D, C, B, A, but I'm not too worried about whether you got the right order or not. It's more about the principles behind the decisions that you make. So let's look at why E is first. So E says, press the panic button and leave the cubicle. Why is E so important? Number one, you're removing yourself from a threatening situation. That is important. You feel threatened. You've got to remove yourself from that situation. You're prioritizing your safety. So the clinical is, yes, patient safety, but also it relates to your own safety as well. Also, you're alerting colleagues by pressing the panic button and you're getting immediate help. So that by far is the most appropriate action to take because you're doing something that helps the situation right now and getting yourself away from a threatening situation. It says very clearly that you feel threatened, so some action needs to be taken. Then comes D. Remember, let's go back to D. D says, say that you have to leave under the pretense that you need to help a sick patient. So this is good because you're taking some direct action. You are removing yourself from the situation. You've decided to get yourself away from that threatening situation, so it remains in essence a good one. It doesn't make, however, the rest of the department aware of a potentially escalating situation. So with E, for example, you're pressing the panic button, it's alerting colleagues, whereas with D, even though you're removing yourself from that difficult situation, you're not informing anybody else at this point, and you may potentially put other people at risk if the patient were to leave the cubicle because people aren't aware of what's going on. So again, it's about communication and making sure other people are aware, and that's why this is not as good as option E. Then comes option C. Let's go back to option C. Demand that he calms down or that you will have to call security. Now, this comes below E or D. Number one, the word demanding is important here. If this said, for example, you're attempting to reason with the patient, then you may think a little bit differently. But that word demanding is basically showing that you're going to show a level of aggression, for example, or that I'm in control, or that you need to calm down. Giving that ultimatum in somebody who's already a little bit aggressive is probably going to irritate him further. So that's not ideal in the first place. And secondly, by doing this approach, you're not actually removing yourself from the situation. Remember, E and D, it tells you in the statement that you're feeling threatened. E and D are taking some kind of action to remove yourself from that situation. C is not doing that. Safety has to come first. So the fact that you're not walking away is going to put this lower down in terms of the most appropriate action because you're staying in that potentially threatening situation. And also, like we said, the word demanding is not ideal here because it's likely going to irritate the situation a little bit more. Next comes B. Let's go to B. B says, pretend to answer your bleep and say that the current cubicle is needed and together move to a room near the nursing station. Now, when you read this first, you might think, okay, this is a sensible thing to do, and it probably is a sensible thing to do, move closer to the nursing station. However, there's a couple of things that put this much lower down. Number one, you're not alerting anyone else to the situation. So yes, you may move closer to the nursing station, but you're still in that threatening situation on your own with that patient. You've not taken the ultimate step of removing yourself from that situation. So that's not great. And like I said, we're not telling anybody else about the situation. Whereas in E, for example, by pressing that button, you're doing that so you're making other people aware of the potential risk. Also, even though you're moving from one room to another, you've not really done anything to help with the patient calming down. So the risk is the same to you as if you were in the original place in itself. So you can see, even though when you read this at first glance, it seems like a reasonable thing to do. Actually, when you look at the endpoint, am I removing myself from that situation? Am I alerting others of the situation potentially getting worse? None of these two are accomplished, and therefore B goes much lower down than the other options. And then of course you have A, suggest that he makes a complaint to the hospital patient advice and liaison service. Again, when you read that at first glance, it seems reasonable. This person is annoyed, frustrated, suggest that he makes a complaint to the hospital patient advice and liaison service, or PALS. That seems reasonable. But when you think about it from an endpoint point of view, number one, are you removing yourself from that situation? No. Number two, are you alerting anyone to the potential dangers or a safety risk? No. Number three, are you taking any action at all that actually tries to calm this person down? No. Therefore, even though at first glance this sounds like a reasonable thing to do, and at some point that may be something that is offered, it goes back to that first thing I talked about. What sounds good versus what sounds good now. And therefore you can see that A must come lowest on this list, even though when you first read it, you think that may sound like a reasonable thing to do. So hopefully, again, I'm not too worried whether you got the order like this or not. It's about the principles, and hopefully you can see how these things make a difference. Number one, the or mindset when you look at a ranking question. Would I do this, or this, or this, or this, or this? Take one away. Now out of these four, would I do this, or this, or this, or this? That or mindset is important. Number two, the 4 C's: clinical, convenience, communication, colleague support. Can they help in this situation to try and push one above another or push one below another? And number three, what seems right versus what seems right now? What is going to take some action now that changes the situation or gets me closer to a wanted endpoint? Hopefully you can see how those make a difference. That's your ranking SJT example. Now let's look at a multiple choice SJT example. Now we've already talked about how your mindset should be different. You're thinking about an and mindset here, but give this a go. Pause the video, have a think about which 3 in combination would work best, and then restart. And we'll talk about how technique can help. So let's break this down then. The suggested combination of things to do is D, F, and H. Now you may have got these 2, 3, you may have got 2 out of 3 of them, you may have got none of them at all, but it's more important about how you go about using the information we talked about to try and come up with the best combination. Now remember, we've talked about how you'd be looking at the and mindset when it comes to a multiple choice question. You've got to think of the 3 things that in combination make the best overall approach to going forward. And D, F, and H in combination probably is the best way to handle this situation. Now, this is a challenging situation because there is nothing in this statement, nothing in the question that suggests that any kind of patient safety issues are currently happening. Yes, you need to look to see, could that be a factor? But at this point, it doesn't tell you that. So you can't assume that John is an unsafe doctor, and therefore this takes away a couple of options that may need you to escalate things up pretty quickly. Also, it could be all due to chance. It could just be that John happens to be dealing with those types of patients at present that take a little bit longer. So there may be nothing in it at all, and it could just all be due to genuine chance in terms of what John is dealing with at this point. And thirdly, there may be some personal issues going on with John that could be impacting either how he is carrying or how he was coping. And either or, you've got to find those things out to see if you can offer support. So by going to John genuinely himself and talking about whether he's struggling and inquiring about the patients that he's talking about can help to identify some of these potential issues. It can also help to determine whether he is dealing with more complex patients, for example. So that is generally a good thing to do. Go and talk to the person yourself in a kind of relaxed manner rather than going straight up to, say, a consultant. If, for example, there is issues or worries about patient safety, then of course, this might not be appropriate. You may need to escalate things and go up the ladder a little bit, but this statement doesn't talk about that, and therefore going to him himself may be a useful starting point. Then again, given that there are no patient safety implications, it would be useful to talk about this as a team in general. It's courteous. You're not often going straight to him to direct it. You're not going straight to a consultant to say, well, this is what's going on. Talking about it as a team in general may be useful because you can understand dynamics about how the ward is working, and maybe there are things that can be done to improve the way that everybody works when you discuss things informally. And also, and this is better than B and E, because in B and E, remember, you're going straight to a consultant, and in E, you're kind of passing the buck by saying, kind of talking to a nurse and hoping that they will speak to John. Both of those are not appropriate. Talking as a team will be more appropriate. And then also D, reflecting on your own portfolio about how to deal sensitively with concerns about a colleague is important, because remember, you are also in a situation where you are trying to develop yourself, both in a clinical way, of course, but also in a general professional way as well. And reflections and writing these in portfolios can be helpful for you to reflect on these situations, whatever the challenge has been in that situation. So as long as there's nothing more important that needs doing, like patient safety concerns that need acting on, reflecting is always a good thing to think about in combination with other things, as long as the other things are being dealt with by the other two options. And for example, talking to the person involved, talking to other team members is covered here. Therefore, D becomes a good option. So in combination, D, F, and H work best to try and help take this story forward, as they are taking actions that may be important to take now rather than in the future as well. Let's go through a few others. Option A, provide feedback on this on his anonymous multidisciplinary feedback. Some of you might have put this because on the surface, it seems like this is quite a good thing to do. This person anonymously would find out. There's no kind of personal discussion going on, but the thinking of is this good versus is this good now is important here. This is a good thing to do, or it seems on the surface like it is, but it's probably not going to impact things right now. This could happen maybe 2 or 3 months down the line. If there is a situation that he needs help with, for example, then it's a little bit too long and it might be missed. So even though that might seem useful, you've got to think about what may be useful now. Option G, unprofessional. Let's talk about option G. Say nothing, but try to ensure that he is left seen with more complicated patients, instead trying to balance the unfair workload. That's unfair. Again, by doing this, you can't understand any potential issues that might be there, either patient safety issues that may come up or colleague support issues that may be needed. So G is not ideal. And the other one we haven't talked about, C, suggest to seniors that there is an ongoing audit looking at how many patients are clerked per team member. Again, may on some level seem like a reasonable thing to do, but it's not going to impact the situation right now. So hopefully by doing this question, you can see how that point about what sounds good versus what sounds good now is really important when you try and determine what are the best actions to take, whether it's a ranking situation or whether it's a multiple choice 3 from 8 type of situation like this one. So just reviewing those technique issues, and hopefully you can see how these things can really help, particularly in more challenging questions where it's not obvious what the answers might be. And a lot of these questions in the professional dilemma paper are going to be like that. You've got your mindset to think of first. If it's a ranking question, think of the or mindset. If it's a multiple choice question, think of the and mindset. Think about those 4 C's, clinical, so patient safety, but also your own safety as well, convenience to you and to others, communication needs for patients and colleagues, and then colleague support, both available to you, but also colleague support that might be needed as well. And then think about what seems right versus what seems right now. And if you think about these things in combination, if you get to those challenging situations that you're not quite sure what to put or what goes first or second or what goes in combination with each, then these things can sometimes help. But hopefully you can see how technique makes a big difference when it comes to the SJT paper. It's not just about quickly going through them and hoping that the answers come without doing any kind of thinking behind it. So now we've talked a bit about a couple of questions, how they run, what MSRA is all about. Let's talk a bit about how to prepare, bearing the things in mind that we've just talked about. The first thing we're going to talk about very briefly is strategy, or having some kind of planner or planning system. The second one is a dual preparation approach, how you need to do 2 separate things to make the best of your preparation time. And thirdly, we're looking at how to focus both on knowledge, but also technique, and how these things can really help. Let's start with strategy or planning first. Now, there are many different ways that you can strategize or plan. If you don't know how to strategize, if you're not sure how to strategize, one thing that we can certainly suggest is our daily planners. We launch these 90 days before every MSRA, 60 days before every MSRA, and 30 days before every MSRA. So wherever you are in your preparation, you can find a planner, a free planner that can help. Just go to the website auroramedicaleducation.co.uk, click on the free downloads or free planners tab, and you'll find that you can just download these off, stick them on the wall, and it gives you a day by day, a dated account of what to cover. And it covers both clinical and professional dilemmas. So you know that as long as I stick to one of these planners, I will cover everything. So that's one way of strategizing. Some people will make their own strategy or their own plan by saying, look, for 1 week I'm going to do clinical, then 1 week I'll do SJT. But you do need to have some kind of strategy, some kind of plan in place, whether you're 1 month for your exam, whether you're 6 months for your exam. If you don't have a plan, then you're going to find when you get nearer to the exam itself, there are lots of things that you realize I don't know much about or I haven't had time to cover, and then the stress levels build. So the first thing to focus on to make sure you're preparing effectively is to have a planner. If you don't have a planner, head to the website and you can just print one off for free to use. The second thing to get right or make sure you have a plan for is to build up knowledge. Knowledge comes from both the clinical side of things that we all tend to think about, but also professional dilemma side of things as well. Let's start with clinical. Remember, if you just rely on question banks to build up your knowledge, you'll learn quite a lot from the stems and the answers that you get and the suggestions as to why that's the right answer, but you're going to have gaps because you haven't found a system to cover everything. A question bank can't cover everything. So when it comes to clinical, of course, you've got guidelines, and there are lots of different sources of guidelines out there. There are lots of different types of guidelines, but the ones that I would focus on for this exam are going to be NICE CKS, if there is a NICE CKS guideline for that particular condition, and NICE guidelines in general. Remember, NICE CKS is kind of an amalgamation of lots of different guidelines, including the NICE guidelines themselves. So at some point, you've got to find a system to cover core guidelines for acute conditions that are important to know about, chronic conditions, and rarer but important conditions as well. Secondly, chronic disease, things like asthma, things like diabetes, things like hypertension, angina, hypothyroidism. Doesn't matter what specialty you're going into, you're going to need to know chronic disease. So make sure you find a way or have a system to cover the core guidelines for chronic disease, and make sure you know them pretty much inside out, first line, second line, third line, because they're things that any clinician is going to be expected to know. Thirdly, make sure you know your red flags. Make sure you know your NICE 2-week cancer referral guidelines, because if you don't know those, it doesn't matter what specialty you're going into, then there are going to be some queries and issues there. So make sure you find a way to cover red flags. We cover all of these, of course, in our own online courses and audiobooks and mocks, but there are lots of different ways that you can go about finding them. But make sure you find a way to learn them, and then make sure you go through medical emergencies, because again, it doesn't matter what specialty you're planning to go into, you need to know how to handle acute medical emergencies, things like meningitis, maybe things like anaphylaxis. You've got to find a way to boost your knowledge from a medical emergency point of view. And then you've got knowledge from a professional dilemma point of view. So for example, make sure you go through the GMC's good medical practice guidance, because a lot of decisions that you make in the SJTs are going to be based on a core understanding of duties of a doctor. And make sure you briefly go through things like medical ethics as well, because again, that can help you to make certain decisions when it comes to professional dilemma questions. So knowledge is a big part. And what I see a lot of people do is just do lots of questions like we talked about, but there's a dual preparation approach that we talk about, knowledge versus questions, and you've got to find a system to boost your knowledge at the same time as building up your practice of doing questions. And the third big thing to focus on is technique, and this is the area that I spend a lot of time advising of the need to do, and unfortunately a lot of people don't spend time on, and therefore they lose a lot of marks based on poor technique. We talked about the clinical side of things, the kind of things that we look at, making sure that you don't miss the small words, making sure you change double words to a single word, making sure you kind of almost subconsciously pick up soft words versus hard words, and making sure that every single word or part of a statement is correct or incorrect before you put your answer to it. But it's about how you look at technique when you do your general questions as well. Of course, you're going to be doing lots of questions regularly. Make sure if you get a question wrong, try and understand or focus on, was it because of a lack of knowledge and therefore do you need to work on that bit of knowledge, or did I know the knowledge but still get it wrong because my technique was poor, and therefore what can I do to improve my technique so it doesn't happen again in future questions? If you got questions right, the temptation is just to think, oh, I got it right, quickly read it and move on. But there's lots you can learn from a right question as well. Can I learn some more knowledge about that area? If I get a question on this aspect, would I know it, for example? Are there any gaps there? Or can I reinforce my technique? Did I get that right because I just guessed it right? Or was my technique good, and therefore can I make sure that I do this again in a future question type like this? So again, you can learn a lot from right questions, you can learn a lot from wrong questions, but understanding technique is key to making the most of every single question that you do. And then of course, when it comes to the professional dilemma questions, remember when you're doing practice questions, don't worry so much about whether you got it right or wrong, because that's going to come with time and understanding of principles and getting the technique right. Just make sure you understand justification. So whether you get it right or wrong, make sure you go through it again properly and try to see, look, did I use these things to try and get this question right? Did I think about the and mindset versus the or mindset, depending on the question I was doing? Did I try and think of, or can I now think of how these 4 C's may help: clinical, convenience, colleague support, and communication? And then, did I think about this framework? What seemed right when I read it versus what seems right now when I think about it in a different mindset? And again, going through these things regularly as you go through these questions when you do your practice is important to improve your technique point of view. And if you build up your knowledge and you build up your technique as you're preparing for MSRA, you'll find that you're getting more confident as you do more and more questions. And when you get to the exam, you feel like you're in the best position to try and get that mark as high as possible, to try and get you into the training route of your choice. So of course, practice is a key part of things. So you're going to be doing questions, but how do you focus your questions to make the best value out of doing them? So obviously you're going to be doing questions here or there. That's understandable. You're going to have some days that are very busy. You're going to have some days where you may be off and you plan to do a lot more questions. So it's important to do regular questions here or there just to keep things ticking over and keeping that problem solving aspect of your brain sharp, but it may be worth varying it a little bit. So for example, on Sundays, you do topic based. So you do lots of cardiology questions, or the next day you do lots of respiratory questions. But some days maybe it's worth to just randomize up a little bit and make sure that you're getting used to things coming you at different directions, that you're not expecting what's coming when there's one dermatology question, then you got to switch completely to endocrinology. And it's worth doing a bit of both of these. So you've got some kind of structure by going through topics, and you've got some days where it's a bit random, so your brain's getting used to that as well. Again, the combination of both make practice much more efficient. You've got to try and do these kind of time pressure situations as well. There's no point just doing thousands and thousands of questions in a nice relaxed environment and then go to the assessment where you've got this time ticking behind you. Do some self-made mini mock. So make, and even if you've got only half an hour, just do maybe 10 questions in time conditions back to back, or 20 questions in time conditions back to back, and then go back and revise and learn and read through them all. Don't do question, learn, revise, question, learn, revise. Try and do some time-based situations as well. You can make them yourself based on whichever question banks you have. And then of course, at some point, probably further into your preparation, make sure you sit down and do some full mocks in timed conditions, both from a clinical point of view and from an SJT point of view. Even if you've done lots of kind of mini self-made mocks, doing this as a formal thing is very important to get you used to the stamina that you need to get through question after question after question after question with that time pressure around you as well. And of course, our packages have lots of pre-created full mocks for you, but you can also get other ones that you can create yourself. But make sure you do the full lot several times before you go into that main exam. Now, I've talked a lot about the MSRA support that we offer, and we've mentioned a couple of times in the video already, but our most comprehensive package by far is our MSRA Gold Pass package. This is designed to look at both the knowledge side of things, but also the technique and the practice side of things as well. And the combination, remember, they can give you the best chance of getting a high score. So the Gold package teaches you in lots of different ways: video-based teaching, audio-based teaching, mock exams and questions, digital flashcards. But again, they're all focused on both clinical and SJT, but also knowledge plus technique as well. So the Gold package contains, for example, 2 full online courses: one clinical online course covering all the core guidelines that you need to know, one covering the SJT questions and the principles that we've talked about and putting them into practice. We've got lots and lots of mock exams split between clinical and SJT, so you get lots of practice under time conditions. It's got things like our pharmacology flashcards, it's got our clinical guideline digital flashcards, our SJT principle flashcards, as well as audio teaching both for clinical and SJT as well, and some more things as well. And anytime we add more things to this bundle, they can get added to your package if you've got it. You get 12 months access to everything. So if you're right at the beginning of your preparation, or even if you're a month away, you can use this package to full advantage, but useful to try and hit those various areas that we've talked about in the previous parts of this video so that you get the highest chance of getting a high score. If you go to the website auroramedicaleducation.co.uk and look at MSRA Gold Pass package, you can watch samples, you can listen to samples, you can do sample questions and look at some of the sample flashcards for you to make the choice as to when it's best to get it for you. But remember, if you're preparing for MSRA, make sure you try and integrate some of these things that we've talked about in this particular video. Yes, do lots and lots of questions, but really pay attention to your technique, how that can help you both in the clinical questions, but also the professional dilemma questions, and make sure you're boosting your knowledge for both aspects as well. And I'm sure when you put those things together and do lots and lots of practice, you will get a really good score in MSRA and hopefully put you in the best position to get into the specialty of your choice. I really hope this has been of some value. If you have any questions, then please do contact me at any point. You can go to a lot of our free MSRA teaching on YouTube, Instagram, Facebook, TikTok, LinkedIn, pretty much every social media stream that you can find. Just try and search Aurora Medical Education or Dr. Owen Aurora and you'll find us there. We have a weekly teaching email that goes out every single week with some clinical scenarios, some questions, some videos just to keep things ticking over in your preparation. And of course, we have lots of free MSRA webinars before each exam. So hopefully we can meet you on some of those as well. Thank you so much for your time. Once again, if there are any questions at any point, feel free to reach out.